What's up, guys? Here today with Dr. Josh at Allied Chiropractic and Rehabilitation. He's going to go over shoulder impingements today, talk a little bit about what causes these, and we're going to show some treatment, and then we're also going to show what we can do at home to, whether it be get rid of it or just keep us from getting it in the future. He's going to be working on one of the athletes, Zach, who is actually going through a shoulder impingement right now. So we're going to go out and sit down. We're going to show Dr. Josh how he treats Zach and kind of how we can get rid of this moving forward.
All right, we're going to go over some shoulder impingement things today. First, a couple indications of what shoulder impingement is. Essentially, shoulder impingement occurs when there's a lack of scapular mobility. And what we see is when you go to start raising the arm, we start seeing an elevation in the scapula versus maintaining the scapular position with abduction or flexion. So Zach, if he's holding here, if we push down, we're going to get some restrictions in that shoulder, we're going to get some weakness, we'll get some pain. A lot of times when we lose scapular mobility, we start impinging upon some of the musculature, particularly some rotator cuff muscles within that upper shoulder, particularly supraspinatus. When you get abnormal scapular movement, we don't allow, all the movement begins to take place particularly directly within the shoulder joint, and then we lose the rhythm. We start to overstress and overload some of the structures within the shoulder, and will lead to pain, inflammation. The longer it's there, then it persists and becomes difficult to manage. Treatment-wise, we want to make sure that the muscular mechanics are intact. So treatments such as myofascial release, using the lacrosse ball, ART, foam rollers, those are the kind of things that we want to mobilize and generate as much pliability within these tissues as we can, decreasing some of the pain, improving the ability to mobilize the scapula so there is a rhythm when we go to use the arm, the scapula actually moves versus the scapula staying fixated and then all the motion occurring here in the shoulder joint. When we go through patients, we let them know there's 17 muscles from the side of the neck to the shoulder blade, but there's only one joint. So the only bony joint there is for the arm is here at the SC joint in the front. Everything else is controlled by muscles. So if we do not have proper muscle coordination, we don't have proper muscle mechanics, we start to overstress some of these other structures, leading to pain and inflammation. So Zach, one of the primary dysfunctions of primary pain generators is anything lifting overhead. So if we go through the left side, we'll see this, if we look at his trap, we'll see that trap stay there as he comes up. So that means as his arm comes up, the scapula retracts, he clears away for the shoulder. On the right side, he goes to raise this up, we'll start to see this whole thing elevate. Here's the impingement at that spot. We want to see this come down, clear the area, so actually the arm can abduct. So what we want to do with Zach at this particular time, we're going to go through some myofascial release, making sure that the scapula can do what it needs to do. We're going to go through joint mobilization, ensuring that the actual shoulder joint or the glenohumeral joint is able to abduct and able to rotate properly. Then we'll get into some rehabilitative measures for it.
Oh yeah.
Up. A little higher. Up. Up. Good. Here. Up. Cross. Reach. Go. Reach. Good. Up.
All right, guys, so lastly what we want to do is we want to show you how you can handle some of these things at home and how you can repair a lot of this. So one of the things you're going to do is you can start with a lacrosse ball. Obviously this isn't a lacrosse ball. Start with a lacrosse ball, you're going to lean against the wall, and you want to start this on your infraspinatus here. Now, the key to this isn't compression. You don't just want to throw a bunch of your body weight into the muscle. All that's going to do is cause more inflammation, bruising, and ultimately probably make it worse. What you're doing is you want to put this on the muscle to pin the muscle down. You're going to start with your thumb up, and from this portion, you're going to reach as high as you can in the air and come back. And you want to work through a couple planes of motion as you're doing this. Like I said, you're doing it to just pin the muscle down so that as you elongate your arm, you're elongating the muscle also. And this is going to help kind of stretch that out and create a little bit more mobility in there. All right, the other exercise you can do is laying on your back You want to get a dumbbell, hold it in your hand, keeping your hand perpendicular to your shoulder. And all we're going to do is we're going to do a little scapular retraction. So you're going to hold the dumbbell and you're just going to push the shoulder up and bring it back down. And you can repeat this a few times on each side. This is a great prehab movement to not only if you're already dealing with it, but to keep you from dealing with the shoulder impingement. So again, you're just going to keep your wrist and your hand perpendicular to the shoulder. You're going to reach your hand up as high as you can and bring that back down and flat. That's it.